It's a holiday medical Monday on Great Day. Our expert has some tips to help you save your voice. Belting out carols isn't the only way to strain it. And want to know how to max out your dental benefits between now and the end of the year? We have you covered. Great Day starts now.
Welcome back to Medical Monday. Hypothyroidism can cause a host of health problems, and oftentimes it's not detected in standard tests. Earlier, I spoke with the author of Hormones, Health, and Happiness, Dr. Stephen Hotze, about proper diagnosis and a natural solution. First, let's explain what the thyroid is and what it does in our body.
Thyroid gland, of course, is located in your neck. It's shaped like a butterfly, and it produces thyroid hormones, which govern our body's metabolism. And in other words, it enables your cells to produce and use energy, and that's what enables the cells to function. I like to describe it like a little, I like to describe thyroid hormones like spark plugs. And every cell is a little engine. You got to have spark plugs in the engines to run. Now, if you operate 8-cylinder car on 6 spark plugs, it's going to run, but it's going to run sluggish. So you want to make sure all your spark plugs are sparking, so you can run that engine real well and you can be on top of your game. So your body needs energy. Every cell in your body has to have energy, most importantly your brain. So as we age, our thyroid hormone levels inevitably decline just because our thyroid gland.
And symptoms can be
the symptoms will be inevitably fatigue. I don't feel well, I can't think clearly, I've got brain fog, I don't sleep well, I got joint muscle aches and pains.
Skin dryness.
Dry skin, cold hands, cold feet, difficulty with weight, hair falling out, just loss of romantic moods and inclinations, depression.
You said loss of romantic news, and somebody said yes. Yes, over there, yes. All right, so we have some folks out here in the audience, Dr. Hotze, who have some questions. Some of them believe that maybe thyroid could be their issue. And ma'am, hi there. What's your question for Dr. Hotze?
Hi, I am, well, mine is not really directly related to the thyroid gland, but I'm going through menopause. Right. 56 years old. And I have a bad case of night sweats. I sweat constantly. I am in full menopause, had a hysterectomy. I wear a patch chlamyra, but I can't stop sweating, and I want to know of some natural remedies that maybe you could suggest.
Well, the most natural remedy is to replenish your body with the same identical hormones that your body is no longer making because of the change of life. Now, the chlamyra patch obviously isn't working for you, so I'd recommend you use natural bioidentical estrogen. It's called Bias, which contains estriol and estradiol, and that's a compounded prescription, and your physician can recommend that and prescribe that for you. Inevitably, as you mature as well, your thyroid hormones are going to decline too, so all these hormones work together synergistically. So after doing a full evaluation of you and really a clinical evaluation, we may find that you would also benefit from a little bit of thyroid as well as estrogen, and we always use progesterone to help balance the estrogen. These are all natural hormones that your body used to make when you were much younger and really felt on top of your game. So that's what I'd recommend.
There's a couple things you said there. One is compounded and one is bioidentical. Right. So explain what those...
Well, bioidentical means the hormones that we replenish are the same identical hormones your body used to make in adequate amounts. And they're compounded at a compounding pharmacy. They're not, most are not, some are available through pharmaceutical preparations, but they usually only have 1 or 2 dose strengths, and oftentimes women need to be customized, so you may need more or less than another woman, and that has to be compounded for the strength that would be beneficial for you.
All right, next question.
Hi, Dr. Hotze. My name is Dawn, and I kind of have the same problem as her, but now I've went through menopause many years ago, right. And my problem is I continually perspire all day in my head, just in my head and chest area.
Well, again, and this been going on how long?
I'm going to say it's been 2 to 3 years that it's gotten worse.
Right. And you also may benefit from a little bit of natural hormones. You know, obviously you're not making them anymore.
Yeah.
And so that's why people, as we get older, feel like we've gotten older, because our hormone levels have declined, or in women particularly, we're no longer producing those hormones. So that can be very beneficial, and that ought to be something that ought to be considered. And you could at least have a clinical trial to see if it benefits you.
All right,
Okay.
next question.
Okay, thank you.
Thank you.
Good morning, Deborah and Doctor.
Hi.
Several years ago, I was diagnosed with hyperthyroidism. I went through the radioactive iodine. And all of the symptoms that you've mentioned, I have every one of them. My biggest concern, though, is the insomnia and the hair loss that has not stopped.
Well, and you're taking a preparation for thyroid?
I'm taking Synthroid now.
You're taking synthetic thyroid.
Yes.
In our experience, after seeing 20,000 patients at our center, the Hotze Health and Wellness Center, we found that the desiccated, natural desiccated thyroid, which can come in the form of Armour thyroid or a compounded preparation.
Armour thyroid.
If you take that in adequate amounts, that should obviate or eliminate that problem. We find that those people that take the synthetic thyroid, while it normalizes their blood levels, it doesn't remove their symptoms. So that tells me it's not working right at the cellular level. And we found that the natural desiccated, which means dried thyroid, which is derived from pork gland. That's where it's derived. But it's the same identical hormone, thyroid hormones our body makes, and it contains the active thyroid hormone T3, which is very important that the synthetic doesn't. So that might be something that you would try alone and taking in adequate amounts. We found that it will usually eliminate those symptoms.
Okay, now I took the Armour thyroid, and I've been told that they've discontinued it. I can't buy it in the pharmacy.
No, that's wrong. It's available now. Although sometimes there are shortages of that, and it can be compounded. At our pharmacy, we compound that.
Okay.
We prepare that in the pharmacy.
Okay.
All right, I want to wrap up with just how important the thyroid is. Hypothyroidism and heart disease has a link. It's also, thyroid can be a natural solution to treat low progesterone. So just that people need to know what's going on in their bodies, because the answer can be as simple as something like
low thyroid, and that's something that we found that is very beneficial long-term in enabling people to obtain and maintain health and wellness naturally for the purpose of enjoying a better quality of life.
All right, we all want that. Thank you very much,
Thank
Dr.
you.
Hotze.
Thank you.
For more about the Hotze Health and Wellness Center, you can call 281-698-8698, 281-698-8698, or visit the website hotzehwc.com. Dr. Hotze also hosts a local radio program, Health and Wellness Solutions. That airs Monday through Friday from noon to 1 p.m. on KSEV 700 AM. Or you can listen live online at drhotze.com.